Good afternoon all and welcome to another Secret Sunday session. Today I am very lucky because I am joined by Joanna from Melbourne, who specialises in the gut, and we're going to talk a lot about gut health today. And so to start off, I want to ask you, Joanna, who are you and what it is that you do?
Awesome. Thank you for having me. I'm really excited to be here. So I'm an accredited practicing dietitian. I'm also a registered nurse. So dietetics is kind of my second career, which is kind of a tangent from my first career. I spent the first sort of 15 years of my life working as a nurse in operating theatres. So my specialty was anaesthetics and recovery. So I was putting people to sleep and waking them up and basically not talking to anybody.
Wow.
A big part of that was very much obviously making sure people are breathing, because we want them to breathe. That breathing is a good thing. But also with anaesthetics and recovery, a really big part of our focus is pain management. So obviously if a surgeon's going to be cutting you open, you're going to wake up sore. So we have to make sure that there's really well managed pain management during the operation and make sure that people are waking up comfortable after the operation. So that pain stuff, the reason I'm talking about that is because that's the stuff that's kind of transferred from my nursing over to my dietetics. I always loved nursing, and I was always fascinated. Like so many days I came home from work just going, wow, what the human body is capable of, and what we are capable of in terms of science and in terms of surgery and things that we can do, blew my mind at times, and it just amazed me, and I loved that. But I was never really passionate about nursing in general. I suppose I loved helping people, but there was always this other part of me that I kind of felt like there was something missing, and there was something else there that I wanted to do. And a lot of the time I felt like we were doing surgery to fix things that actually could have been prevented if we had intervened a lot earlier. So instead of putting a band-aid on something, can we prevent it happening in the first place? After my son was born, I obviously took a year off with maternity leave, and I went back to work, and I felt kind of disillusioned because there was all the same people doing all the same things. And I started thinking, is this really what the rest of my life is going to be? Or do I want to sort of do a bit of a stock take and a bit of a review of who I was and where I was going? And I've always had a really strong love of food and health. I personally have had gut or food intolerances and gut problems. I was only 12 months old the first time my mother took me to a doctor and said there's something wrong with this child's gut. So I actually don't know what it's like to not have gut symptoms. And for many years, I thought it was just part of me. It was my makeup, and I had to learn to live with it and whatever. But I knew that food played a role. And so that sort of always had me an interest in food and in health, and what can I do to help improve myself. So that was when I sort of said, well, perhaps I should go back to university and do dietetics, because it's kind of dietetics, it's still helping people, it's still that sort of science and that nutrition science and what have you. And then I can sort of work on preventing people needing surgery in the first place, and I can also sort of learn more about my own body and about how food's affecting my own body. So that was what kind of took me back to university, and I went and did a Masters of Dietetics, and I graduated from my Masters of Dietetics in 2015, and by that point I'd actually been nursing for 20 years. So I'm 27, but anyway. So when I graduated from my degree, obviously during my dietetics, I learned a lot about gut health and a lot about nutrition, and we didn't really, it was very much medical focused. So we spent a lot of time in the hospitals doing clinical practice, a lot of learning about diseases and how nutrition affects those diseases, but we didn't have a massive focus on food intolerances as such. So, and that was something, like I said, I've been in the hospitals for 20 years. I wanted to get out of the hospital. I'd had enough of a hospital. I wanted to get out into the community. So I kind of set myself up that as soon as I graduated, I was ready to get started. And I started my practice, which is everyday nutrition, and started seeing people one-on-one out in the community with a real focus on gut health and food intolerances. Obviously, I had to then go and do some postgraduate training. So I spent some time in Sydney at Royal Prince Alfred Hospital Allergy Unit, learning about food chemical sensitivities and allergies and things like that. I spent some time with Monash, did a few Monash workshops and the FODMAP training for dietitians with them, learned about all of that stuff, and just kind of hit the ground running and started focusing on gut health along the way. So that's kind of what I do now. I've grown my business. I've now got 3, there's myself and 2 other dietitians that work with me, and I've got a 3rd one starting in July. But what we really focus on is helping people firstly calm the gut, because when people have got gut issues, it's miserable and it's debilitating and it's affecting every day and every aspect of your life. So we want to help them calm their gut and feel better. We want to help them pinpoint their triggers, where their thresholds are for their triggers. And most of all, using that information to help them make peace with food again. There's so much, and certainly what I've noticed myself, which I was saying to you earlier, when food is triggering gut symptoms, there's a lot of fear and anxiety and things related to what you're eating, what you're going to eat, who you're going out with, what food's going to be on offer. And we really want to take away that unknown factor so that people have that positive experience of, yes, I can eat this. And if I do eat that, this is going to happen and I can deal with that. And we really want them just make peace with food and start to enjoy life and start to enjoy food again, because there's so much good around food. It's
That's awesome. It sounds like you've experienced a lot and grown a lot over that time. And it's amazing what you're doing. I want to talk a little bit about intolerances and allergies and things like that. I don't know if it's just me, but I find that there's just so much more people with gluten-free diets, with dairy-free diets, intolerances, celiac. Why do you think that is?
I think that's a really good question. And obviously there's no solid answer to this. And I think that there are a few things that impact on it. One of them is that I think that we're a lot more aware these days. And certainly with the FODMAP diet becoming really well known, it's kind of put IBS as such, or food intolerances, on the map. And people are just more aware of their options and aware that they don't just have to live with things anymore. I think perhaps our generation is a little bit different in terms of, I think that some of the older generations are a lot more stoical than we are, and I think that they lived with a lot, whereas our generation is more likely to stand up and say, actually, no, this is not okay, and this can be better. So what can we do to make it better? And I think that that's having that, and then with the internet and giving us access to all that more information that the older generations didn't have, our food supply has changed a lot. I don't want to demonize any parts of food, but certainly our food is a lot more processed than it's ever been. It's a lot more widely available than it's ever been, and it's cheaper than it's ever been in the past as well. So we've changed as people, our food supply has changed, and we're more aware. So multiple factors, I think, contributing.
How can you, I guess, manage that when we can't change our food supply because of the way that, society is developing now? Things are just being cheaper because they're artificially made. So how do we manage that new lifestyle?
There's no one answer that's going to be right for everybody. It's kind of about working out what's right for you. And certainly, look, there are a lot of every food that's sitting on the shelf in our supermarket has been processed to some degree. Even an apple, it's been through some sort of processing. Nothing is completely unprocessed. But there's a huge difference between a bowl of oats and a McDonald's hamburger. So I think that working out what works for you, what fits into your life. Obviously, food is not just about nutrition, about fuel. It's about connecting with people. It's about emotional. It's about people eat for religious reasons, for social reasons, for emotional reasons, for social connection, and all of this stuff. And working out what works for you and what fits into your life, that's going to help you feel good physically, mentally, and emotionally, because health is about all of those things. If you're healthy physically but not mentally, you're not healthy overall. And I think so much focus on I've got to eat in a certain way, that ends up affecting your mental health. So we've kind of got to find that sort of room for flexibility, and at the same time working out what works for you, what you tolerate, where your thresholds are, how far you can push things, to find that balance between living life and enjoying food and managing your gut and your food sensitivities.
Yeah. Is there a really strong mind and gut connection?
Absolutely. 100%. In fact, so we talk about the head brain and the gut brain. The gut brain is actually the only organ in your body that can function on its own without the head brain overseeing it. So your lungs and your heart, the head brain's keeping an eye on that all the time. The head brain doesn't keep an eye on the gut brain all the time. It kind of does its own thing to a certain degree, but we've got this vagus nerve, which is this two-way superhighway that's going between the head and the gut, and there's constantly information going backwards and forwards. Research is indicating that there's actually more information going from the gut to the head than there is going from the head to the gut, which is interesting, but that kind of emphasizes what the gut brain does. One of the ways that I kind of really like to understand the gut brain and that gut brain axis is that when we think about our head brain, so I first relate it to that. So we've got 5 senses, and this is where that sort of pain management comes across, because IBS and food sensitivities are a type of chronic pain. And chronic pain is where there's nothing actually physically wrong with the body, but the nerve endings are responding as if there's something dangerous or there's something going on and something that needs to be fixed, and it's sending pain messages to get your attention to fix that. So pain is kind of this protective mechanism. And when we're talking about chronic pain, we're talking about pain in response to something that doesn't exist. So it's kind of misinformation. When we've got our 5 senses, we've got our sight, our touch, our smell, our taste, and all of those things. And our senses are constantly collecting information from our outside world. So where we are and what's going on around us and what's happening. And it delivers all that information to the head brain. The head brain then takes that information, it weighs it up against our current situation. So what's going on and how we're feeling about where we are right here and now. It weighs it up compared to past experience. So the last time we were in this situation, what happened? It weighs, and it also weighs it up against future expectations. So what do we think might happen as a result of where we are right now? And the head brain then decides if or what it needs to then do with that information. And if it decides that there is something dangerous or something that's potentially damaging to us, or it needs to get us out of that situation, it actually then sends pain messages to get our attention and get us to do something about it. So all pain is actually produced in the brain. It's not in your finger. So if you're putting your finger, a nice example, you put your finger on an element, the element's hot, your touch collects that information of heat. It sends that heat information to the brain, and the brain's going, oh, that's really hot, that's going to hurt us. I'm going to send pain back, because that's going to get you to move your finger away from the heat, and then you're not going to burn yourself. And that's kind of how pain works. When we're talking about chronic pain, it's sending those pain messages when there is actually nothing wrong. When we sort of relate that then, so if we relate that down to the gut brain, so which is the enteric nervous system. So we've got the sympathetic and the parasympathetic, which are the head brain. They control fight and flight and rest and digest and all of that stuff. The gut brain is the enteric nervous system, and it controls the gut. And what its job is that it collects a whole lot of information about what's going on in our inside world. So what's happening inside our body, what's happening with our digestion, what's going on down there. And it's sending all that information to the head, and the head decides, is this something I need to worry about, or is this not something I need to worry about? And when we've got somebody with food intolerances or with IBS, those nerve endings in the gut that are collecting that information tend to be oversensitive. And they're collecting more information about digestion than they would in somebody who doesn't have IBS. So anybody who eats a can of beans is going to create gas in their gut. Somebody who doesn't have IBS, they're going to say, oh, I'm farting a lot today, isn't that funny? Whereas somebody who does have IBS, all those nerve endings are collecting all that information about this gas production in your gut and over communicating it to the head brain, and the head brain's then freaking out. Oh my God, the last time this happened, I had a lot of pain. This is something wrong. It's going to be painful again. I better send pain messages back to get your attention and get you to change something. So that's kind of my extended, in a nutshell, spiel of kind of that gut-brain axis and where it sort of plays a role. And there are so many things that influence it, but it's fascinating how what our body's capable of and what it does to try and look after us and try and protect us, because that's what it's trying to do. Yeah. It's just getting misinformation and getting a few confused messages along the way. So it's overcompensating.
Yeah. So how do you balance that mind and gut connection to allow the brain to relax and go, hang on, we're not being chased by a tiger?
Yeah, great question. And when you think about the nervous system, you see all these pictures of these bodies in all these science magazines, and they sort of draw the nervous system in, and it kind of looks like it's hardwired, like the electrics in a house. The cool thing about the nervous system is that it's not hardwired. It grows and it learns and it evolves, and we can actually teach it new tricks along the way. There is some really, really fascinating research into things like gut-directed hypnotherapy that is targeting and teaching these gut nerves to behave in a different way. I know Professor Worrell, who's a gastroenterologist, he's been around for years, but he first researched gut-directed hypnotherapy in the 1980s. And he got a group, it was only a really small study. There were 30 people, but there were 30 people that had medically diagnosed IBS that hadn't responded to traditional treatments for their IBS. So whatever they tried, nothing worked. They were still getting these IBS symptoms, painful symptoms, severe, daily, debilitating. And what he did is he put half of them and gave half of them gut-directed hypnotherapy. The other half of them, he gave them talk therapy with a psychologist and placebo medication, so just sugar pills. And he measured them for a few different things. So in terms of symptom severity, quality of life, anxiety and depression, and those gut symptoms and things. And what he found at the 12-week mark, the people who had had the gut-directed hypnotherapy had a significant improvement in their symptoms, whereas the people who were having the talk therapy and the sugar pills hadn't had any real improvement at all. So this was kind of like this groundbreaking study that actually put it on the map and said, yes, this gut-brain axis is real, and yes, it has an influence on the gut, and yes, we can teach the gut new things. Since then, there's been lots more studies into it. The most recent and probably well-known study was one that came out of Monash, I think in about 2017, where the researchers, they had 75 people with medically diagnosed IBS. They put a third of them on a low FODMAP diet. And by this stage, we had pretty good research that a low FODMAP diet works for about 75% of people with IBS to get a significant and a consistent improvement in their symptoms. So we knew that that worked. They put a third of them on gut-directed hypnotherapy, and they didn't change their diet at all. And then a third of them had that combined hypnotherapy and FODMAP diet to see if that was kind of any difference between them. And they measured them again at baseline at 6 weeks and again at 6 months for symptom severity, quality of life, anxiety and depression. And what they found at that 6-week mark, all three groups had an equal improvement in their symptoms. So they took away from that you could actually get as good an improvement with gut-directed hypnotherapy as you could with a FODMAP diet, and you didn't have to change your diet to get there, which was really cool. Then at that 6-month mark, they measured it again, and they found that all three groups had maintained their improvement. But the people who had the gut-directed hypnotherapy were scoring significantly better results in terms of anxiety and depression. Obviously, we need more research into this, but changing your diet is a stressful thing to do. So if we can get these results and we don't have to change your diet, I'm going to put myself out of a job, because my job is, I'm a dietitian. And look after your mental health along the way. Isn't that almost the ideal situation?
Yeah, oh, definitely. And especially I find anxiety and depression, that would play a major role in your gut health as well.
Well, absolutely, because when your head is stressed, all the nerves in your gut are stressed, and it's going to increase the sensitivity of those gut nerves as well. And look, we've all had butterflies in our stomach. That's an example of the gut-brain axis. So when we're stressed, that gut gets unhappy, and when that gut's unhappy, it's oversensitive. It's in that fight flight mode. It's always looking for that tiger that's going to attack us, and it's always looking for more gas production or more digestion or more of that sort of thing in the gut as well. So absolutely.
It's incredible because I find even in the eating disorder spectrum that we're diving into with the secret burden, there's so many issues with recovery, people that are going through recovery after, the refeeding, and the gut sensitivity is just incredible because it's just your body's just reacting to everything, and sometimes it's really hard to help support young people through that time when they just keep experiencing the pain, and there's so much information out there.
Yeah, absolutely. And look, certainly if you haven't been, if your gut hasn't been working, and you're starting to feed yourself again, then yes, it does feel like you're reacting to everything. More often than not, it's just the gut learning how to work again. And it's not necessarily that you're sensitive to the food. It's just those things with the sensation of having food in your stomach when you're so used to having that empty feeling. Even that is a foreign thing, and that's something to get used to again. It's not dangerous, it's not wrong, but it's just that you've got to get used to it again, and the gut's got to learn how to work again.
So
that's an ideal situation where I'd be looking at gut-directed hypnotherapy rather than an elimination diet. And certainly in those cases, often elimination diets don't work, and all they do is start bringing up those sort of feelings and thoughts and behaviors around controlling eating again, which we don't want to do. We don't want the cure to be worse than the cause.
Yeah. And it's funny, there's two things with, I guess, treating gut health, as you said before. It's the physical side and the mental side, and you can't do one without the other, which I think is a very important message. I also want to talk, so when you talk about the chronic pain and obviously those two treatments as well, the FODMAPs diet and then also the hypnotherapy. What about when you are experiencing pain and you may not have access or don't have time to follow those sort of practices? Is there something you can do, or is it just best to ignore the pain and let time heal itself?
There's always options in terms of what you can do. I think that really that mindset has a really big influence. And that's certainly if you're not accessing gut-directed hypnotherapy, absolutely there are things, meditation, calming techniques. One of my favorite things to do, and I actually do this with my son when he gets himself stressed out as well, is what I call it our grounding exercise. And it's just where you sit down and you say, hey, I'm feeling, you acknowledge, so often giving an emotion or a sensation a name to start with. It's like, hey, I'm feeling really anxious about this, and acknowledging that's always the first step. When we're looking at doing, I need to, so I'm feeling anxious, I need to do some grounding to get myself out of the spiral. Here I am doing psychology now. I'm supposed to be a dietitian. And what I do is I say to him, okay, this was one time we were driving back from the mountain, and we were in the car going around the mountain, and he started getting himself stressed out that he was getting car sick. I said to him, all right, sweetheart, let's stop. Let's look around us and think of 5 things that you can see. So, and I want you to tell me what their names are. So he looked around, 5 things he could see. And then I said, okay, what are 4 things that you can touch? And then we did 3 things that you can smell. And we went through each of the senses and named each of these things. And what that does is it brings you, it's sort of a mindful moment. It brings you back to this mindfulness. It brings you back to the here and now, and removes this worry about the future and the stress about the past. And I find that really beneficial, because we spend so much time worried about the future and stressed about the past that we forget where we are now. So that's a great technique to use. But there's also things, certainly if people are experiencing things like a lot of bloating, there's a supplement called Iberogast that's been shown to be really helpful for bloating. We can also use certain fiber supplements to keep the gut moving. There are certain things like that that we can do. Some people find that probiotics are helpful. Some people find that they're not. That's kind of an individual thing. But if I'm sort of looking at non-food, non-gut hypnotherapy related things, I might be looking at what we will call empirical treatment options. So I might look at a symptom and I might say, okay, what can we do to directly treat this symptom? So if somebody is feeling bloated, we might try agarigast. If someone's got a lot of constipation, we might try something like a couple of kiwi fruit or a fiber supplement to get things moving again. And often, certainly with constipation, if the gut's sluggish and slowed down, you're going to feel backed up, you're going to feel uncomfortable. So if we can get things moving, that often calms the gut and makes people less uncomfortable and less backed up. If someone's getting lots of loose stools, then we might bring in, again, a different type of fiber supplement that sort of binds, soaks up that water and makes the stools more formed.
Yeah, wow.
So,
And I want to touch on that because I find there's a big new marketing campaign, new space for probiotics and sort of naturopath supplements. What's your take on that? Is it something that we should be considering for our gut health?
Great question. I love this question, actually. So probiotics, these are live bacteria that when you swallow the bacteria, apparently it's supposed to set up home in your gut and start altering the gut bacteria and infer a positive benefit on the person. A prebiotic is something that when it is not a live bacteria, it's usually a food of some sort, and when you eat the food, it passes through the digestive tract into the colon, and in the colon it then nourishes the bacteria that already live there. So the probiotic's the bacteria and the prebiotic is the food for the bacteria. Now, we all have about 2 kilos of bacteria that live in our gut, and in fact the bacteria that live in our body outnumber our body cells by trillions to one. There's more bacteria than huge amounts of bacteria. There are more different types of bacteria than there are stars in the Milky Way. And what we know about people is that this 2 kilos of bacteria that live in your gut are more individual than your fingerprints. So around about a third of the bacteria that live there will be common to people that live in a similar environment to you, and then 2/3 of that bacteria, nobody else in the world has that. You know, that's your bacteria. What that means in terms of gut, so we now actually, science is at the point where we can take a poo sample and we can map that sample and we can tell you what your gut bacteria looks like. What science is not able to do is what that's telling us is that everybody's gut is completely different. And we don't have a gold standard to then compare that to and say, oh, well, this is what a gut should look like and yours looks like this, so this is what we need to change to improve it. We just don't have that. Anyone that's going to take a stool sample and say, oh, you're missing this and you're missing that, we need to fix it, that's speculation, because science does not have that information at this point. And they are speculating way ahead of what we're capable of. What we know is that having a lot of bacteria is a good thing. Having a lot of different types of bacteria is a good thing. But it's starting to look like you have strains, obviously, that I don't have. I have strains that you don't have. And it's starting to look like that actually doesn't matter as long as you and I both have the particular niches to perform certain tasks. It's not so important what it looks like as it is what it does. And that's starting to look more important. So when we've got that information, we say, should you take a probiotic or a prebiotic? Maybe, maybe not. We can't guarantee that because we don't have the science to say that. And certainly in terms of a probiotic, there's no way of saying, oh, well, you're missing this strain, you need to take this probiotic and that's going to fix you. We just don't know that. The research has shown that probiotics, around a third of people, it makes them better, a third of people it does nothing, and a third of people it makes them worse. The American Gastroenterological Society at the moment is saying that there's insufficient evidence to recommend probiotics for IBS because we just don't have that information. If people want to play around with probiotics, I tend to treat them like I would treat a drug. So I would recommend certain probiotics for certain symptoms. It's kind of like if you're going into a pharmacy, if you've got a headache and you want a headache pill, you're going to get a Panadol, you're not going to get a birth control pill, you're going to get the one that's actually designed to treat the symptom you want to treat. So I kind of treat it like that. But I don't use probiotics a lot in my practice. I don't find them overly effective. look, every so often I get a random person who finds that, wow, this makes a big difference. But in general, I don't. I tend to use prebiotics a lot more because prebiotics tend to nourish that bacteria that are there. Remember, we want lots of bacteria and we want lots of different types of bacteria. So if we're feeding our bacteria and looking after that natural microbiome that you have and keeping that healthy and helping that flourish, that's generally what I want to be doing first off. And then saying, okay, once that's good, then say, okay, where does the dust settle and where should we be going next?
Yeah. So we talk a little bit about the history of the gut microbiome. It's something that I don't think a lot of us know about. I've recently sort of delved into it and discovered how fascinating it is. But what is it and how do we get it? Because I know we're not just born with it.
True. Although how we're born and what our mother eats when she's pregnant does influence the gut microbiome. So we've got microbiota, which are the bacteria, and the microbiome is the sum of all the bacteria and all the fungi and all the organisms that are living in and on your body. The majority of it is living in your large intestine or your colon. Bacteria that live there, they do a lot of really amazing things. So they're involved in immunity, they're involved in gut barrier function, they're involved in digestion of food. We know they influence glucose metabolism, we know they influence mental health. Actually, there's a really fascinating study on mental health and food, which is fascinating. I'll come back to that. And they also influence heart health and all of those sorts of things. So they're really, really super important for keeping us healthy, and they perform a lot of functions. Actually, 90% of your serotonin, which is that feel-good hormone, is produced in the gut. Your brain just uses it, but your gut actually produces that serotonin. In terms of how your gut bacteria are formed, so your gut, usually during the first 3 years of life, that's really when your gut bacteria is getting formed. It's influenced firstly by how you're born. So whether it's a cesarean section or a vaginal delivery, that influences your gut microbiome because you pick up bacteria during birth or not. How you're fed in those first few years of life, whether you're breastfed or bottle fed, has an influence. We know that breastfed babies have different microbiome to bottle fed babies. Your environment, so whether you have pets at home, babies that have pets at home have a different microbiome from babies that don't have pets at home. The types of solids they're eating and when they start eating, their environment. So this part of the world compared to another part of the world. So many different things impact on it and settle in your gut. By the time you're about 3, your body has established its normal microbiome. It says, okay, this is my gut. This is what I'm going to be carrying on with. After that, your microbiome can change. So obviously, if you take antibiotics, that's going to alter your microbiome. If you have a big weekend away with the girls at the wineries, that's going to affect your microbiome. If you go away to Bali and you eat different food for a couple of weeks, that's going to affect your microbiome. Your stress levels are going to affect your microbiome. But one of the things that is still theory at the moment, but they're talking about it in the scientific circles, is this theory of resilience. And with resilience, what we're talking about is how quickly your gut returns to its norm after an insult. So if you take antibiotics, how long does it take your body to return to its norm, or your gut to return to its normal state after those antibiotics? And that's something that I'm really interested to see where that goes in terms of gut health, because that's a really important factor. Because if you're killing off your microbiome or your microbiome's changing, is it going to, it does come back to normal. And some of the science is indicating after antibiotics, within about 2 weeks, most people's gut is back to what it was. But yeah, I'm fascinated to see where that resilience theory goes in the future.
And if we talk about the effects from, as you said, if you have a big weekend out with the girls or you take antibiotics, what's changing in the gut then?
So antibiotics is kind of an easy one. So antibiotics work by destroying the cell wall of a bit. So bacteria have a cell wall. Viruses do not have a cell wall. And how antibiotics work is by destroying that cell wall. And when they destroy the cell wall, the bacteria dies. So that's just a really simplified explanation. So when you're taking an antibiotic, it's generally a bit indeterminate about which cell walls it destroys. It'll just destroy anything and everything that it comes across. So you're going to destroy some of that bacteria that are living in your gut as well. So you've got to we want that bacteria to replenish after you finish the antibiotics, kills the good and the bad. We want those good bacteria to start growing back again.
Yeah, okay, wow. And then so as well, you talked about when you're born and you're starting to build that gut bacteria inside you. How does it work? It may sound like a dumb question, but do you just metabolize it and then it just like sticks in your gut, or how, and then does it just stop after 3?
So it does. So how does it form? That's probably a really good question. And I'm trying, there's sort of, gut bacteria are picky eaters. So obviously they're alive and they need fuel to stay alive. So it's kind of like you've got a whole lot of little pets living in the gut. And what you feed your gut bacteria will determine what sort of bacteria you produce. Right. So if you're eating a really high fiber diet, you're going to produce a lot of fiber eating bacteria because they're the ones that are getting fed and getting nourished. If you're eating a low fiber diet, then your guts, that's going to support protein eating bacteria, and you're going to get a whole lot of protein eating bacteria. That the fiber eating bacteria, they're the ones that we actually want to encourage. When you're looking at the lining of the gut, you have your bacteria, then you have a nice thick mucus layer, and then you have your gut lining. And your gut lining is these little epithelial cells that determines what goes into the body and what doesn't go into the body. So it's kind of that last line of defense. When you've got those fiber eating bacteria, you generally have a really nice thick mucus layer that's protecting those epithelial cells, and then you have really nice healthy epithelial cells with nice tight junctions underneath. When you're eating a high protein diet, those fiber eating bacteria tend to die off because they're not getting fed, and those protein eating bacteria tend to flourish. Now, the protein eating bacteria, that mucus layer has got proteins in it. So the protein eating bacteria will start to eat away at that mucus layer, and you're not going to have so much protection for those epithelial cells. And then we start seeing those damaged epithelial cells underneath. And that sort of communication with the immune system, it's communication with those junctions over what's getting into your body and what's not getting into your body. I don't like the term leaky gut, but there's certainly gut permeability, and that's going to affect that sort of thing. And that sort of general systemic inflammation, we tend to see that more often in people who have got medical conditions, so IBD, celiac disease, cancer. We tend to see that sort of weakened gut lining more so, but certainly that higher fiber diet is going to really nourish that bacteria, keep that thick mucus layer. What you eat has a massive impact.
And then just to, I guess, end off, what is your advice for someone who may be going through chronic pain in the gut, or maybe experiencing some issues, and there's so much, as I said, so much information out there. They don't know where to look, don't know what to do, but they don't want to be restrictive as well.
It's certainly in terms of improving those gut symptoms, I would absolutely be recommending seeing a specialist dietitian that specializes in gut health. A dietitian can sort of look at your situation, assess what's going on for you, and then make some really strategic recommendations in terms of how to reach your goals, because gut health is so super individual. If you're looking at just sort of improving that gut health and improving that microbiome, what we know is that the more different plant foods you eat, the more diversity and abundance you have in terms of gut bacteria. So, which is why we don't want to restrict, we want to add to your diet. What you add has got so much more impact than what you take away. But certainly a diet, if you've got digestive issues, I'll be talking to a dietitian that has experience in gut health.
And one more question while I just thought of it, the organic spectrum, should we be focusing on organic produce? And I guess because I know a lot, it can be more expensive for people, and people obviously don't take that option, but is it something that we should be considering to help our gut?
So the research shows that organic produce doesn't have any more nutritional value than regular produce. If you can afford it and you like the taste of it, brilliant, more power to you. If not, I'm happy if people are eating fruits and veggies. I don't care what kinds of fruits and veggies they are. If they're eating them, that's a good thing. There is, and actually this kind of urges, there is a type of food sensitivity to something called salicylates. Salicylates are something that plants produce to protect themselves. For someone who's salicylate sensitive, they might get symptoms like IBS type symptoms like bloating, pain, altered bowel movements. Some people get skin rashes and hives, or headaches, migraines, or sinus congestion and things. People that are salicylate sensitive, organic produce is actually higher in salicylates than non-organic produce. So for someone who's salicylate sensitive, we actually want them off the organic.
Wow. I think the massive takeaway from this session is that our guts are all very individual, and you've just got to go off how you're feeling with certain foods and obviously seek help if it's that pain is just continuing. So thank you so much for your time. I have learnt so much myself. I think I'll have to go have a nap because I'm just processing everything. But what you do in your practice is phenomenal, and all that you've learnt, thank you so much for sharing. It's incredible.
Thank you for having me.
No worries at all. And thank you everyone out there for joining us for another Secret Sunday session. And we'll see you again soon in a couple of weeks. Bye.